Welcome to Debridement, a very important skill, a very important knowledge set to have when you're practicing wound care. In this lecture, we're going to give you a brief historical perspective of debridement, and then we're going to look at chronic wound physiology, and we're going to understand how debridement plays a role in the management of chronic wounds. We'll then talk a little bit about the procedural preparation. We'll walk you through various debridement methods. We'll talk about some of the indications and contraindications of debridement. And then finally, we'll leave you with some documentation and coding, pearls and bits of wisdom, if you will. Debridement has been around for a long time. We know that it comes from the French term débridre, which means to unbridle. And if you look to the historical medical texts, it was probably first used by the barber surgeons several hundred years ago who were involved in the management of war zone casualties. And these barber surgeons recognized that injuries associated with grossly contaminated soft tissue wounds were able to heal better if they in fact were debrided or surgically moved with amputation. The outcomes in these patients was better. The barber surgeons were an interesting group. The United Barber Surgeons Company was established by King Henry VIII in 1540. And these two professions were officially separated by King George II, who actually formally established the London College of Surgeons in 1745. Now some of you out there may be thinking to yourself, you know, I don't know that old King George should have ever separated these professions because there is really still so much similarity. For the surgeons that are watching, we know that this was a smart move and certainly needed to happen and probably should have happened much earlier.